We begin with a KOIN 6 health alert. A TriMet bus driver diagnosed with a possible case of whooping cough, and we've learned that the driver may have exposed Portland Public School students who ride his route every day. At 5 o'clock, good evening, everyone. I'm Jeff Gianola.
And I'm Kelly Day. Let's get to the details as we know them right now. We've been pressing TriMet for answers since we spotted this photo on Twitter of a bus draped in yellow tape with a warning about an infection. Then moments later, we asked whether the public was at risk. TriMet sent out a news release stating the driver had whooping cough. And in just the last hour, they addressed some questions now about the public health risk. Chris Woodard is live trying to get more answers from TriMet and health officials. So, Chris, I guess the big question here is, did TriMet downplay this case?
What this really was kind of a mess of misinformation for the last day and a half. What we now know is that this is not a confirmed case of whooping cough. The Tri-County Health Department was here to tell us that today. They say we may never know if this really was whooping cough, but they argue that it doesn't matter if it was because the risk of passing this along to a passenger would have been so low. Now, we want to show you again how this all got started with that photo posted to Twitter yesterday of a bus that appeared to be in some sort of quarantine. Well, after waiting for answers from TriMet about what that photo was all about, they came out today with a press release saying that one of their drivers had a case of whooping cough. Well, then a few hours later in the press conference that we just walked out of, we got word from the Tri-County Health Department that this is not a confirmed case. They say the driver was looked at, released from the hospital, and given antibiotics to treat whatever is sickening him. But the health department said, or him or her, excuse me, but the health department says that we don't need to know if this was whooping cough, like I said, because the probability of passing this along to a passenger was so low. So I asked the person from the health department who was here today, a health officer, why should the public be satisfied with no notification earlier? Why should they be satisfied with you saying we may never know? He said simply because that risk is so low. It takes hours, he said, of prolonged contact for a case of whooping cough to be passed along. So that's where we stand right now. The Tri-County Health Department says at this point, no need to worry, though we may never know what the sickness was that this driver really had. Live downtown, I'm Chris Woodard for KOIN 6 News.
Chris, thanks for the update. We'll continue to press for answers.